Thanks very much for the opportunity to speak today. So my name is Sarah McGillivary and I'm a team leader for Chrysalis Community Drug Project. Chrysalis provides harm reduction support and care to thousands of people negatively affected by substance use since 1998 in the North Inner Sea. Chrysalis offers a case management service, counselling and therapeutic groups, and all our programmes are open to men and women over the age of 18, living in Dublin 1 and Dublin 7. Our treatment programmes at Chrysalis are client-led and client-focused, and we believe in recovery for all. We believe recovery does and should look different for everyone, advocating for individualised treatment plans. By request of the HSE, we expanded our service to the North East Inner City in 2019. This saw us develop community and clinical case management teams working in the OST of CH09 area. We recognise the emergent need for dual diagnosis support with our service users, but this has been a constant undercurrent which services have for a very long time worked with informally. To explain some about the framework of case management working with dual diagnosis does not mean we work beyond our limitations of case managers, and in practice it permits a platform of onward referrals to ensure the appropriate access to service. It is a process that supports and encourages people who use substances at each stage of their change of behavioural cycle. It can only be effectively delivered through an interagency approach, and the benefits of it is it permits personalised service, continuity of care, improved recording and a high level of accountability alongside regular reviews. The approach of case management working with dual diagnosis for us was an obvious position to take. We've been working this model alongside psychiatric services since 2020 in the NEIC, and the evidence from our practice is it limits the possibility of individuals becoming lost or overwhelmed in the system. It supports and advocates the needs of the individual. It ensures timely follow-ups and it promotes service user autonomy in treatment. Overall, the case manager is the person responsible for ensuring any identified blocks or barriers are addressed or alternative routes are taken. And the role of the case manager requires a high level of specific skills coupled with ongoing continuing professional support and development. And these skills warrant acknowledgement and appropriate remuneration. They are professionals in their area of expertise, and there is a high level of accountability for this job. Moreover, there is a considerable difference in pay scales in voluntary versus statutory services. And for us to maintain a proficient service delivery, we do find it challenging to retain case managers with relevant experience, as financially we're not in a position to offer salaries matching that of their counterparts. We have noted that our staff are receiving approximately 20% less than that of their counterparts in statutory services. And this is relevant because it's extremely problematic as it impacts our service delivery, continuity of care, which ultimately is destructive to our service users. Services like Chrysalis and others have effectively been treating dual diagnosis for many years, and going forward it makes sense to further invest in existing resources and services currently working within this remit to fine-tune the reach and effectiveness of service delivery. If there is anything to take from our practice, it is this: addiction and mental health issues do not discriminate based on postcodes, and therefore, most importantly, to conclude my opening statement, we hope the mantra of no wrong door policy driven by the National Programme for Dual Diagnosis is afforded to all those looking to seek access to care. Thanks for your time, this matter. I welcome any questions.
Thanks very much.